Now, however, health authorities have raised their voices against the EFF's threats. Organizations, including the Wits Faculty of Health Sciences, the South African Medical Research Council and the HIV Clinicians Society, say they are extremely concerned at the unwarranted accusations against the regulator SAHPRA, including that it has disallowed the registration of those two vaccines, the Sputnik V and Sinopharm from China. The statement says it's essential that SAHPRA is insulated from untoward political interference and protected from the threats that have recently been leveled against the organization and its members. Well, SAHPRA says it has an evidence-based approach that looks at the benefits and the risks of every vaccine. It has confirmed that the documentation it requires from the vaccine maker itself was only received this week in relation to the Sinopharm vaccine. It's also not finished evaluating the safety data for the Sputnik V from Russia. The World Health Organization has approved both vaccines for emergency use, and they are being used in dozens of countries around the world. However, the Sputnik V shot is undergoing a review by the WHO that has recently identified a problem at one of its factories. There are also some concerns about the efficacy of the Sinopharm or Sinovac vaccine after several countries that have used the vaccine widely have seen new COVID-19 outbreaks. Meanwhile, looking at the picture in South Africa, infections in Gauteng are soaring, and the third wave in the province is proving significantly more dangerous than the first and second. The acting health minister, Kubai Ngubane, says that she will meet with the government's COVID-19 Ministerial Advisory Committee on Saturday to further look at lockdown restrictions. To discuss, we're now joined by Dr. Aslam Dasoo, who is the convener of the Progressive Health Forum. Doctor, thank you for being with us. So the Progressive Health Forum is part of the statement against the EFF. Just outline your concerns.
Good afternoon, Francis, and thank you for inviting me. We have huge concern, not just about the attempt to intimidate an organ of state like SAHPRA, but the way in which this has been unfolding. Organizations like the EFF should be careful what they wish for if they're going to do it in this way. What we saw today was we were gobsmacked that people would, in the midst of the worst wave, of the worst pandemic we've ever known, congregating in this fashion. You can be certain that a number of the people at that march will have been COVID positive, that a number of them will therefore spread it to others, and a number of those will be hospitalized and require ICU, and some will die. So it's deeply ironic that a march that is ostensibly meant to save lives will result in deaths. And this is completely beyond the pale. And I think the EFF has missed a beat here in going to march to SAHPRA. I must say that when I heard Mr. Malema speak, at the outset, he made some very rational commentary about the fact that we were in lockdown, that we accepted lockdown. The government said they would fix up health services, reinforce them, get vaccines and vaccinate the population. Well, that hasn't happened. And he's correct that that is unacceptable. But to get to SAHPRA, to force it to register vaccines misses the point entirely. He should have taken that grievance right to the door of the government, the Department of Health, that is responsible for that. SAHPRA is a creature of statute. It works constitutionally according to rules. Even its personnel cannot change those rules. All medicines and vaccines must be registered by SAHPRA once they have determined its safety and efficacy, so that you and I, when we walk into a pharmacy or when we get a jab, we can consume that with great confidence. And that includes the EFF. So SAHPRA is not something that we should just play around with. I use the analogy. You can't go to the Civil Aviation Authority and insist that they allow flights by SAA when it is not commissioned. No one should get into those aircraft, and the same thing here. So we are quite alarmed that this has happened. And then we are even more alarmed that there has been direct physical threats against personnel in SAHPRA, which has been gendered, I should say. And this is unacceptable.
You're talking about the EFF saying it will go to the CEO's house?
Sure, and to the chairman's house, as Mr. Malema said today. Now, it's a free country where a constitutional democracy and freedom of speech is acceptable, in the normal course. But when we have restrictions on lockdown, and when there's a flagrant disregard, such as during this March, of those lockdown regulations, one must ask, where was law enforcement on this? Where was law enforcement when these threats were made? Moreover, where was the government, which has an obligation to protect organs of state like SAHPRA? We have heard not a peep for over a week since these threats have been made from the government protecting SAHPRA. So someone needs to answer for that.
Okay, so thank you for that response. And yes, we can see in the visuals, a lot of people are not wearing their masks or are wearing their masks incorrectly. However, the rhetoric is out there around the Sputnik V and around Sinovac. So I'd like you to respond to some of the claims. Let's look at the facts. Both of these, as I understand, have been approved for emergency use by the World Health Organization. They are being used in several countries. So South Africans are looking at that and saying, why haven't we already gone through the regulatory process here? Why are they not available? Give us more details, because Sputnik V, I know there's been problems found at one of the factories, but still many countries using it. Sinovac, Sinopharm, some concerns about the antibodies, about how effective it is. But again, it's being used in many countries in the world.
Sure. You're quite correct. The World Health Organization has approved these vaccines for emergency use in their assessment of these. SAHPRA, our regulator, and other regulators worldwide will take that information and verify it and approve or otherwise these vaccines. In the case of SAHPRA doesn't solicit applications. Applications come to it. So I believe that the applications for Sinopharm and for Sputnik are in. The problem arises that when the applicants are middlemen and not the pharmaceutical manufacturers, such as in the case of AstraZeneca and J&J and Pfizer, that they don't actually have the relevant information that SAHPRA requires. And I believe that they have been asked for this information. So it is true, and I agree with Mr. Malema, we need vaccines and we need vaccines urgently. So I put to him, therefore, go to those applicants and ask them where is the information so that SAHPRA can evaluate it and approve these vaccines. That would be an appropriate approach to saving lives that even we could support. But unfortunately, that's not how this is being seen. It's as though SAHPRA is the be-all and end-all around what vaccines we get. That is not true. So the applicants must forward the relevant information, and SAHPRA must be left to do its work independently, without any political influence, so that you and I can be certain that when we take the vaccines it approves, we are doing so with confidence that it's safe and that it's effective.
All right. Finally, we're running out of time. Let's quickly look at the situation in Gauteng. Does this call for extreme measures in Gauteng? We are off the charts now. And what's driving this? So earlier experts said it was the SA variant. That's why Gauteng was being hit particularly hard. But a lot of concerns among South Africans that this dreaded Delta variant is now spreading. What's the situation?
Yes. I think let's firstly say that the numbers we are seeing are record-breaking. We've just had about 19,000 new cases in the latest reporting cycle, with about 11,500 here in Gauteng alone. The graph in Gauteng is no longer a curve. It's going straight up. And this is causing great alarm. And there has been concern about whether new variants are driving this. They may well be. And we know that the sequencing is happening right now. There is a concern that Delta, the one first identified in India, has made an impact now in South Africa, as it's making an impact around the world. It is 64% more transmissible. That's what the UK studies have shown, and there's no reason why it isn't that transmissible here. So it may well be a greater proportion of the Delta variant driving the infection. However, we're quite certain that the Beta variant, the one that drove our second wave, is still the dominant variant, although the Alpha variant from the UK and the Delta variant are much more prominent in our suspicion. Let me put it this way. We suspect that these are much more prominent in the overall circulating virus load. And this is driving the infections. We are very worried about Gauteng. There has been, and let's just be clear about this, there are no beds in our public hospitals. Whatever the government is saying about things are under control, they're not. Right now, people are being sent away from hospitals, gasping for breath, having to die at home. It's as bad as that. The march today will turn out to be a super spreader. I have no doubt about that. But I must make an appeal, therefore, to Mr. Malema, to the EFF, and to every other political party. PHF has the information through its associates and its members to give them the best information. And I make an invitation to meet with them so that we can share all of this with them, so that we don't have to go through this again.
Doctor, thank you for that valuable update as well. That was Dr. Aslam Dasoo, also criticising the march today, convener of the Progressive Health Forum.